Good morning, everyone, and welcome to our first Pediatric Innovation Training Capsule. So today we will talk about the implementation and adoption of innovation in children's hospital with experts from 3 different countries in Europe. But so before to jump into the topic, I would like to introduce you shortly to the i4KIDS Europe Training Capsule. So this training capsule will last 45 minutes and the session is currently recorded. Please have the microphone muted during the presentation, and we will have a Q&A at the end of the presentation, so interaction will be more than welcome. So don't hesitate to use the raise hand option at the end or for questions and comments, or write in the chat if you prefer to. Just a small introduction to i4KIDS Europe for those who don't know the initiative. So it's a Horizon Europe project. It comes from a context that there is a lack of European focus on pediatric innovation, where health innovation still tends to focus more on elderly people. And there is also a fragmentation of the ecosystem in Europe, and it arises the need of a European pediatric innovation network. So for that, these 5 countries that you can see on the map, Spain, Poland, Denmark, Latvia, and Finland, joined to launch the i4KIDS Europe project in 2023, which come from the initial i4KIDS initiative from Sanchis, and to allow synergy and reduce differences between strong and emerging innovator ecosystem, and as well to strengthen the innovation competitiveness of European pediatric sector. So for that, we had, for those who could participated, we had our the Pediatric Innovation Day 2023 in Poland some weeks ago, and the first at European level, where the report on pediatric innovation situation has been presented. And we will currently launch the Pediatric Innovation Training Capsule. That's why we are here today. And I'm really glad to start with this initiative that will be a monthly training capsule. So we'll start with the first one today with our 4 experts. So please welcome Katariina Gehrmann, Maria Sanchis, Tomasz Maciejewski, and Wiktor Możarowski from Finland, Spain, and Poland. We are really glad to count on their presence today. And Katariina, if you are here, I will maybe ask to start today to give this deep dive in implementation and adoption of innovation in children's hospital.
Thank you, Charlotte, and i4KIDS Europe for the opportunity to share here a very short update or knowledge about some financial instruments to adopt innovation. So this is the talk today. So for being possible to adopt the innovation that different research centers, hospitals, universities, or technology transfer offices does, we really need to support in different angles, but one important part is the financial part of it. And this is something I will talk along with this training capsule. So how different healthcare systems, hospitals, or any type of procurer, especially public procurers, can adopt innovation from the community or the market or the research groups. So if we pass to the next one. So what is the pre-commercial procurement of innovation and the public procurement of innovation? So in the next slide, I can show you how these are some financial instruments that they come from the demand side. what does entails? This entails that we create or innovate from the real unmet need, that it could be a clinical need, but also a market gap or a technology not being ready for these needs, or because there is a need of changing the business model, the reimbursement model, etc., etc. So, so these are policy instruments, and they have been on since 2012. I'm sorry, but I hear some noise in the background. Some people has the microphone on, and I get a bit, okay, thank you. So these instruments were impulsed by the European Commission for giving the public procurement with some tools for procuring innovation. They are thought to be cross-border, so transnational instruments, but they can be applied in a regional level or even in a cross regions or national level with different hospitals. So it can be applied at different levels. And we have two different instruments, and I will explain you why. The first one is the pre-commercial procurement of innovation. So the public procurers are looking to procure in an early stage. They are not looking to procure or to put a financial procurement to get a final product, but to shape or to drive the innovation in the way they think the innovation should fulfill their needs. So this is why this pre-commercial procurement of innovation is outside the public procurement law. So this law doesn't apply to this financial instrument. And the activities that there are under this pre-commercial procurement of innovation is to help these translational buyers to procure research, development, and validation. And also is the first deployment of an innovation solution in a real setting, and looking always to improve the quality and efficiency in areas of public interest. And also, on the other side, to provide to innovators with market opportunities for industry, researchers, etc., etc. And then we have another instrument that is the public procurement of innovation, where it's more advanced in the development of the innovation. So in that sense, these activities are more looking or directed towards the deployment of innovative solutions early to overcome the fragmentation of the demand, also to share risk and costs in between the procurers and the technology providers, and also open market opportunities. So sometimes what we have found out is that a technology push coming from innovators doesn't really overcome, or the value proposition doesn't really overcome the real needs in terms of clinical, but also organizational, structural, also from patients' perspective. So an early engagement and this demand-side innovation could be one of the keys for later on being able to adopt this innovation, because it will really fulfill the need of the clinicians, hospitals, etc., etc. So these instruments, if we pass to the next slides, they have a structure. So the pre-commercial procurement could be thought as buying research and development, and not fully research, but more development. So in phase 0 is been a curiosity-driven. There has been some research that is sitting there in a hospital or a university, but this technology needs to be adapted or needs to be replying to a need or a call that this public procurers does. So in this phase 0, that usually takes a year and a half, is where the public procurers, together with some research centers and also some agencies for technology assessment or for innovation, they get together and they start analyzing where is the real unmet need, how we can translate this unmet need to a proper challenge and to some requirements that we need to ask the market. They also do some market analysis or open market consultations to assess how is the technology readiness level of the market or of the innovation out there, and to align all that, and this end up in the opening of a call for solutions that is in a tender process, and this is a competitive process. It goes under the competition. So in phase 1, it is the solution design. So in that sense, 4 suppliers will present what is their solution. 3 of them will be invited to present an offer for the second phase that is more on the prototype development. And from these 3, 2 of them will test a minimum volume of product or prototypes, so MVPs, in real setting. And this is to avoid only a single market or to maintain the competition across the process. While in the public procurement of innovation is more mature products, that what happens is that they are not completely fulfilling the need, or they don't have a business model around as is the demand for the hospital or the healthcare system, or they need to change the business model for being able to be reimbursed. And there is always a change management process where the innovators have to adapt their innovations into the real clinical settings, and later on it comes more the negotiation of the procurement, or the way it's going to be procured. But along with the procurement is going to come a development of the solution to arrive to a fully deployed solution that it can be introduced in the market and scale up. Okay, so these are the 2 financial instruments, and the value proposition of these instruments I've been explaining a little bit, but as you can see in the pre-commercial procurement in next slide, Charlotte, is to develop these innovative solutions for societal changes, looking for well-being, security, etc., to provide a first customer reference for innovative companies, also to facilitate the access to new innovative players that sometimes it's difficult to become a provider for big hospitals or even healthcare systems. Also sharing this risk benefit in the design, the prototyping, and knowing what is assessing the value proposition for all stakeholders while you are developing the final solution. Also, you create these optimal conditions for wider commercialization and uptake of the R&D results. And you can also see the reduce of market fragmentations in terms of, for example, pediatrics. It could be very relevant, this type of instruments, because you increase, if you do a cross-border procurement, you could increase the number of cases in rare diseases or particularities in cancer types, for example. So you can create a critical mass and also a push for procurement if you get together under these financial instruments. And also it's a way to attract new investors, because if they know or they have some references of the end users or the final procurers, that will decrease the risk of investment. And I will explain a little bit later with more detail. And then in the PPI, exactly the same. You will have the opportunity as a procurer to shape a little bit the market, but also as an innovator to co-create also this part and open new markets. And then the instrument will foster a market uptake, also increase the quality of the public services, because you can procure solutions not only for a particular disease, but also as a healthcare management system, etc. And also you can support the fast track of the innovation adoption with this access to a market and the investment in this smart investment or impact investment or value-based procurement. So then the next question is how these financial instruments could fast track the innovation adoption. So I've been explaining that in this value proposition, but if we look at the innovation adoption pathway in the next slide, as I've been saying, from taking out an innovation to in the whole innovation pathway, it will come from a research and development in academia that we can support in venture building and move to the innovation validation. But then really what it needs is to get access to patients and to go for the real impact of your solution. And that is obviously from a big uncertainty that you have in academia. You will need to gather evidence in real setting with real patients, with real end users, and remove the uncertainty of the value you create with your innovative solution. And this more uncertainty is usually founded by public funding or philanthropy, while you get more level of certainty or evidence that could be shifted to more venture capital, etc., etc. But still, there are some markets that needs a financial support that in that case could come from the public procurement of innovation. Okay, so here you could see how the pre-commercial procurement and the public procurement will fit in the innovation pathway. So in the next slide, I wanted to, because I haven't introduced, but I'm Open Innovation Program Manager from EIT Health, and how we can support in this initiative. So from EIT Health, we are an organization and a European innovation ecosystem that we have a presence in 7 countries and 10 what we call InnoStar countries. So we are across Europe with different co-location centers. We collaborate with public and private entities to, being an enabler or a safe environment to operate. We have support programs for the industry, for the healthcare system, for the startups at different levels, from education to business acceleration and innovation. And we are, as I said, an open community that we have all stakeholders represented. And for us, this financial instrument and the pre-commercial procurement of innovation and public procurement of innovation is one of great importance and interest, where we are supporting and we want to support further. And in that case, in my next slide, and I finish, and I would like it to finish with good news, is because together with Sant Joan de Déu and other Inveniam, Aqua, Cienciano, a hospital center in Poland, and ECHO, we presented i4KIDS, and i4KIDS is a European project that aims to accelerate demand-driven tools for pediatric innovation adoption. So we will be looking on how we need to improve these financial instruments and adapt them for pediatrics and pediatric innovation adoption. So we will understand or analyze the challenges that the different innovation project players across Europe will find in using or or adapting these instruments, and we will prepare different action plans to foster these cooperations and support activities along the different member states and associated countries. And with all that, we will work towards a co-planning, complementation, and investment in pediatric healthcare in order to reduce territorial inequalities and access to innovation support. So hopefully with this coordination and support action, we will also inform the European Commission and create these action plans that could be implemented in the near future for procuring innovation in pediatrics. And then, thank you very much. And you can contact me if you have any more questions after this event. Thank you.
Many thanks, Maria, for this really interesting presentation and presenting these instruments and this really nice initiative. I'm sure we will have a lot of questions at the end. But for the moment, let's move to the other speaker and keep the question for the Q&A at the end. Katariina, are you here?
Thank you, Charlotte. Yes, my apologies, everyone. I had some technical issues with Teams, but now I'm here and I look at you, so you must probably see me as well, hear me as well. My apologies. So thank you all. I'm the Director of Digital and Innovation Services here at the Children's Hospital. We are the Children's Hospital here in Helsinki. We're part of the Helsinki University Hospital, or the Department of Children and Adolescents. We're part of a big university hospital with all different specialties that there are in healthcare. So children, from our perspective, also is only one part of the service production of the whole big hospital. But today I work for the Children's Hospital, and I'm of course here talking on the voice of children and adolescents and how we tackle innovation and what kind of thoughts I personally have on it. Please, Charlotte, next slide. Can I change them or do you need to change them?
I changed them.
Okay, perfect. So today I wanted to say a couple of words, or I was also asked to say a couple of words regarding the implementation and the adoption of innovation in our hospital. So I will go through a couple of examples and before that maybe demonstrate or state a couple of things that I think are extremely important when we talk about innovation and the actual implementation of it. And thank you, Maria, for your very good presentation. In the next slides, you will see that actually my thoughts are very in line with what Maria also just presented earlier. So please, new slide. So if you think about implementation of innovation in a hospital, in a real world setting, I would say that the most important thing is the engagement of professionals. It is the key to success. If professionals are not engaged, if they don't see the why of something, it will never happen. It will never be successful. Professionals who actually work with patients are the key. When we talk about innovations that are related to actual patient care. Now I talk about innovations that are actually part of patient care, for example, at our hospital. So kind of point number one, engage professionals. Professionals need to be convinced that the innovation actually supports better patient care. They also need to be convinced that it helps their work to do their work better, as in give patients, children and adolescents better care than today. It also needs to demonstrate value. An innovation, you need to demonstrate value with an innovation, because if you don't, professionals will also, and I will ask, as in, why would we want to actually implement this innovation? And when you talk about value, we all know that value can be many things. They can bring value through better quality. Quality can be many things. It can be better quality as in patient, it can be patient safety. It can be improved technologies to treat patients. It can be improved ways of communicating with a patient. For example, different kinds of things can be better quality, right? Also, another perspective, if you don't think about the actual care, is that it can also smooth patient pathways. We might have innovations that help us ensure that patient pathways are smoother than they have been before implementing an innovation. And on the third hand, we all know that the resources in healthcare are scarce, and we are tackling with many resource challenges in Europe within personnel, for example, and at least in Finland also from budgetary perspectives. So if an innovation can show us efficiency gains, as in treating patients, there is already the why to implement something. It's also, when we talk about innovation, it's really important to know that it's actually value-based. And someone might now ask, what's the difference between demonstrating value and ensuring innovation? My point here is that when you buy something, when you procure an innovation, when you buy something new to use in your hospital, the cost has to be in line with the value that we gain. And that is what I mean with value-based. What is the gain, what is the value that we get from an innovation compared to what the price actually is of how much we have to pay. And for all of you who don't know, HUS is a Helsinki University Hospital. We're a publicly funded public hospital. So from our perspective, especially in a publicly funded healthcare system, all the new investments go through an assessment, and we also need to ensure that we use public money properly. And that is why the importance of a value-based innovation is really important for us. Of course, procurement as well. We all know that public procurement is highly standardized and highly regulated, and very well so. It's very good that it is. And this is something that Maria also already mentioned, is that it has to be able to put through our procurement from our tendering processes. And lastly, just as a reminder that I already said, that we have to have value for money if we buy something. We have to know that we really get value for what we actually want to buy to a hospital. Thank you. Next slide. And then maybe I would say that the development of an innovation affects how it's implemented in a hospital. And what I mean with this is that it depends on what part of the cycle of developing an innovation the hospital comes in. Just like Maria, how you explained how we can have a pre-competitive funding or procurement, then we have actual procurement after the innovation is more mature. So from my perspective, from a hospital, it makes a big difference as in when we join. When do we buy an innovation, if it's mature, or if we actually are the ones who are also developing it. So that's why I wanted to have 3 points to this perspective that I think really matter in the actual implementation of an innovation. One is that there's a way that sometimes professionals lead innovation. Professionals might understand that, hey, there's a need for something that isn't out in the market. So there's actually a demand pull for something, a demand pull for new technology, a demand pull for something new that we don't have, to actually solve a problem that we see in everyday life in the hospital. And this is very different from the technology push that might come in, because if you have a technology push, you have to really demonstrate to the professionals the why, as in, why is this important? Why does it bring value? But if it is done with the professionals, the demand pull itself actually has the value proposition in it, if it is well pronounced. Then of course, we do a lot of collaboration in a collaborative innovation with external stakeholders, often through funding instruments through the European Union, or through Finnish funding instruments that are most often public funding instruments, where we of course do innovation together with clinicians or professionals and hospital external stakeholders. Sometimes we might also do innovation with external stakeholders, so that they pay us to do a research, for example, as in pharma, or as in something else. But there also the need, then the collaborative, there might be, especially when we talk about medtech, there might be a collaborative part into this, actually, this development of the actual innovation. And then very thirdly, if you go to life cycle of the development of an innovation, is the adaptation of mature innovations. Okay, one can then ask, what is a mature innovation? We all know most probably they are not mature when they are still kind of, as Maria also stated, that often innovations, although they're mature innovations, but they might not be totally ready yet. But here I'm talking quite of actually quite mature innovations to be implemented in hospital. So in these kind of innovations, often professionals do not take part in the innovation as such. There might be some tailoring of the product to, or the product or the algorithm or whatever it is, to our needs, but usually it is rather mature. And if it is this third part, as in an adaptation of mature innovations, then usually we just buy it through normal procurement procedures. And here we really have to assess the value, as in what does it bring? Because in this place, we're not usually ready to take big risks because it's public money. We have to know that what we buy brings us value, right? Because if we're talking about the innovations that are in the life cycle of being less mature, where we do get external funding to, for example, collaboratively develop something, then we know that there is a bigger risk, as in that the innovation might not, the outcome of the innovation might not be what we hoped it would be. It's risky, right? It's part of the deal. But when we procure something which is mature, we have to per se know that this actually does the job that it is supposed to do, and it brings us value to the hospital. Please, next slide. This is a very busy slide, but I just wanted to add it here to say that we have some networks in the hospital to improve and enhance collaboration with external stakeholders, and we have the Clever Health Network. It is a network-driven ecosystem program where the research community, the healthcare organizations, and health tech companies co-create tomorrow's healthcare. So it's an ecosystem where we do innovation together. We have HUS in the center, and we have a lot of different partners part of this ecosystem together. And we have multiple different kinds of projects to increase innovation with external stakeholders. This is a HUS level thing. This is not a children's and adolescents department level collaborative body, so to say. But we are, of course, also part of this because we are part of the bigger hospital. And out of this, as an example, we have a project called eCare for Me, where we have rare diseases in which the Children's Hospital is partly also, or in a big role. Next slide, please. This is also a very busy slide, but what I just wanted to demonstrate with this is that we are, for example, working together with external stakeholders to improve the diagnosis of rare diseases, because we know that the delayed diagnosis of rare diseases affects most probably a shorter life or even expedited death. And it is also very expensive because we often have to treat these patients many times without actually knowing what they have, because per se rare diseases might be difficult to diagnose. So this is just an example of how we are trying to work through AI analysis to identify these patients that have a risk of having a rare disease, and we're doing it with an external stakeholder with us, and we have funding from Business Finland to do it. So this is just an example of what innovation can be from the collaboration with industry. And here it is extremely professional driven, as in there's a push for it, a push for the need. There is really a pull. There's really a need for new innovation here because we understand that there are unmet needs within rare diseases. Next slide, please. Then very shortly, unfortunately, I will have to, there are three examples that I wanted to show you: the hybrid operating room, the fracture registry, and a sepsis tool. But unfortunately, I will have to skip number 2, fracture registry, and I only have a slide of the hybrid operating room and the AI sepsis tool. So next slide. These are just examples of innovations that we have. So for everyone to know, we have a new hospital, a newish hospital. We've been working in the hospital for the last 5 years now. And we have a very cool thing called an angiography operating room here, or an area for patients that go through cardiac surgery. And they are small children often who go through cardiac surgery. So our chief medical officers who work in this sector, our surgeons, realized at some point that it would be really important to have an angiography in the operating room to actually be used during surgery to improve outcomes. And thus the planning started in 2016, and we got this kind of innovative room operating center into our children's hospital when the children's hospital was opened. And nowadays we have a 3D CT rotational angiography that can take angiography pictures of the patients while they're still under surgery. And the whole point here is that beforehand, our children were operated. It seemed that the outcome was good, and then they went to the ICU and so on. And often it was found out that, hey, there was something wrong with the surgery, that we still have to go back and we still have to enhance something. We still need to reoperate, and the children were sent to reoperation. So in this new innovative model, this angiography machine is used during the surgery when the child is still there, and it's checked that everything is as it should be. And if it's not, they can reoperate. It's not a reoperation, but they can actually kind of fix what should be fixed during the primary operation, so that then when they actually leave the operating room, the risk of having an outcome that is not so good as it could be is a little lower. So this has improved our quality of care a lot through surgeries. So this is just an example of actually implementing something, and from our perspective, a very innovative way of thinking how to improve surgical outcomes of children who are critically ill, who are treated from cardiology. Yes, and so this was just these were my examples and about what innovation our children's hospital is. Thank you.
Many thanks, Katariina, and I guess for the last example, you can contact her directly. So it's just to keep time for our following speakers, which are Wiktor and Tomasz from Poland. So please, the floor is yours. We are going to your slides.
Great, thank you, Charlotte.
Here we are.
Hello, ladies and gentlemen. My name is Wiktor Możarowski, and I am a project manager at the Department of Artificial Intelligence and Innovation Medical Technology at Instytut of Mother and Child in Warsaw, long name. With me is also Tomasz Maciejewski, Director Instytut of Mother and Child in Warsaw, and together we would like to tell you a little bit more about our practical approach to implementation in our hospital, because we believe that we pioneering approach to new technology in Poland. So please, next slide. Maybe about the Institute of Mother and Child, we are the highest references hospital in Poland. We specialize in science and research, of course, but we are also a hospital. In our hospital, we service and medical treatment is also a key area. The most important topic for us is, of course, pregnancy and child and adolescent health. We are also an opinion-giving institute, and we are educational and publishing hospital. This next slide. But instead of our clinical area, we also want to be a hospital of the future, and we believe that it can be if we will be focused on our visions, and one of them is, of course, digital health. We believe that thanks to the new technology and artificial intelligence, we can improve our clinical and patient support. We also believe that we can move the medical metaverse we can move the patient care from our hospital, to patients' homes. So we would also looking for that solutions to implement in our hospital. We also believe that data processing can help us to personalize medicine. So this is our goals. But what do we have now in Poland? Please, next slide. The current situation in Poland is not good as it should be, because only 26% of leaders declare investment in artificial intelligence. This is a whole market of artificial intelligence and what is in hospital area. Please, next slide. AI implementation. Right now at the hospitals in Poland, only 7% of the hospitals utilizing AI algorithms. If we add the medical offices to hospitals, the number is even lower, not even 3%. So we understand that is a little bit complicated situation, because in Poland we don't have yet the reimbursement tools for new technology. We only can use the research grants, for example, from Medical Research Agency, what we of course did, and we will do it. So please, next slide. We believe that the Department of Artificial Intelligence and Innovation Medical Technology in our hospital can change, by our activity, we can change our local ecosystem. And I would like to show you guys what we did already, because our department was born 23 months ago. Since January 2022, our director created this department. We already had more than 50 projects. From this 50 project, we implemented 5 of them, and we created one Central and East Europe activity that I will share with you guys. Please, next slide. And as you can see, this is a implemented project. We already implemented AppMedic, CareBits, CliniNote, MedApp, and Informatica. But for me right now, more important is the right part of this slide, because the MedApp and Informatica. Next slide, please. Because we already implemented these two, and they have one common thing of these 2 products. But first of all, I will introduce you this project. MedApp, it's an implementation of mixed reality goggles that our doctors use in our operating room to have the reference to data in real time during the operation. As you can see, the hologram is putting on our patient, and our oncological and pediatric oncologic surgery clinic have the reference, and they can make operation more precisely. So it's after the survey that we did with our doctors, they pointed that MedApp is really good tool to get more data, more information in real time. And they, I'm not sure, but they give you one slide back, please. The effectiveness and staff satisfaction was ranged by 9 of 10. So this implementation was really good. Please, next slide. The second project I would like to share you guys is a symptom checker and online symptom analysis. It's a survey that we collect data about patient, data about symptoms that our patients have, and with the deep learning algorithm where we collect data, we analyzed and give the information for our patient that they should call the ambulance or come to our hospital, or maybe stay at home and just rest. And this is the tool that reducing the numbers of patients in the emergency room from our side. It also a support for patients at home, for sure, and this is also a tool for our call center to be on good track with the patients. And as you can see, Informatica is also a good tool for us to create marketing, PR, or awareness project, because we know more details about sex, age, conditions, and this next slide. And of course, the most important things is rating is summary for us, and we know what should we do to better implement this tool, or maybe future tools that we are searching. And please, next slide. And what's one thing what is common for Informatica and MedUp? It's a first edition of Mother and Child Startup Challenge that we created 1 year ago. This next slide. Right now we have a second edition of Mother and Child Startup Challenge, and I would like to focus on that topic. So Mother and Child Startup Challenge is our idea to because we believe that pediatric patient and pregnant women are very unique group, and they need really unique solutions. So we create a contest to collect the best startup from Poland, but also from abroad. We create two paths. One path is implementation path, and second one is R&D path. When we are looking for different types of innovation, and we are looking for some kind of startup that we can collaborate or give them our data, help them with our doctors, or just implement them into our hospital. So please, next slide. And I'm telling we, because it's next slide, it's not only the Institute of Mother and Child, but we also have much more hospitals with us on our collaboration. It's also a Żelazna Medical Center. It's also a hospital from Warsaw, Regional Specialized Children Hospital in Olsztyn, Institute of Mothers Polish Health Center in Łódź, Medical University of Białystok Children's Clinical Hospital, and University Clinical Center in Gdańsk. So together we are creating our project, and with us are also much more strategic partners, main partners, and of course honorary patronage, for example, Ministry of Health or the Medical Research Agency, that together we create a local, maybe not local, national ecosystem that we believe that we can create a good environment to implement new solution. And as I mentioned, new solutions from Poland, but also from abroad. This next slide. And with this Mother and Child Startup Challenge, we also create the implementation cycle, because we believe that this contest is a tool that enable us to make annual analysis of the market, of the medtech market in Poland, but also in other countries, and we searching. This is our first step, the process of recruitment of the startup. We are really welcome for our startups from abroad, as I mentioned. The second one is a selection of final startups. So we with our jury and advisory board, we select the best project. Last year it were Infermedica and MedUp, as I mentioned. And this year we will see, because right now we're preparing a final gala. It will be at December this year, and this next year is 12 months of implementation and development and support. So we would like this this contest, it will be a implementation cycle that we believe that year by year we can recreate it and make a good flow for implementation in our hospitals. And what helps us is, of course, visionary leader, someone who helps us to implement our ideas, and of course we're looking for one leader from the group of professionals, for medical doctors. We believe that one of this leader can help really really much, a lot, and we believe that as our team, as Department of Artificial Intelligence, we are open for experimental, for being of a pilot, and we understand that it's never guarantees a success. We are also believe that consciously learning and transparency is a really good area, and really need that that area to bring the new technology in our hospital. And that's all that I would like to say to you guys. Thank you so much for attention, and if you have any more questions, would you like maybe to make appointment with us, please contact us. If you would like to know much more about the Mother and Child Startup Challenge, you have a QR code to our website. So thank you so much.
Many thanks to all of you, to all of our speakers today, Maria, Katariina, and Wiktor. I would like, now we are a bit tight on time, but I would like to open a Q&A. If there is anyone who have a question, please raise your hand or write in the chat if you prefer. Firuza?
Hi everyone. First of all, it was very nice to meet some old faces. So I was just wondering, what is the practical way to pilot our solution in any of the hospitals which are the part of the program? Several startups have solutions which are ready to pilot.
So maybe I can answer. I didn't know how to raise my hand. My apologies on Zoom. May I?
Yeah, sure.
Thank you. So thank you very much for the question. We have piloted some, for example, applications on phones for patients to use. It depends a lot on if it's seen as it has patient-sensitive data or not. If the innovation, for example, a startup has some kind of application or something that can be piloted that doesn't have patient sensitive data, we have contracts that we do with lawyers, and then we come up with all the outcomes as in how long we get to use them and pilot them and so on. So we do it, and it's of course there is no clear one process, because it depends a bit on what kind of innovation we're talking about and what kind of thing we would like to pilot, and if it's really patient care or if it's, for example, patient experience or something that is on the side. But yes, we do that. Thank you.
So thank you very much. So may I contact you on possibility to pilot?
So yes, if you have something, you can contact me, and then I contact the clinicians if they're interested or not, or then we kind of assess the potential. But yes, you can always contact me. Thank you.
I saw a question from Arnaud to Katariina and Wiktor. which would you say are the main challenges for adoption of innovation in your healthcare ecosystem or hospital?
Maybe I will start. For sure, the doctor engage, because I saw it a few times already, that if we don't have the support from clinical our clinical colleagues, we can't do anything without them, and sometimes it's the most difficult distractors to move forward. So from my side, it's the doctors, I guess.
Thank you. I would like to say also the buy-in of professionals. I would say that's number one. But if we have to come up with another one, is also I would say value proposition. You have to be really, it has to be extremely clear as what the value proposition of the innovation is, and it of course goes hand in hand with the engagement of professionals. Thank you.
Maybe I will add something to this sentence, because some of the startups come to us with R&D track in our D track, and some of them are implementation track, and it depends of which number of TRL do you have startup. And from my opinion, the R&D startups need to know what they would like to collaborate with us, because all the time we have that situation that startup came to us and asked us what can we do together, but we accept and we would like to have much more information what they need, and after that we will tell them what we can do for them. Thank you.
Thank you a lot, Maria. You want to add something?
I would like to add one thing. There is the business model around the innovation solution. Sometimes the innovation comes with a very a preconception of the business model around, so it has to be adopted in that way, and we need to pay for this, and maybe it's the product, and while the health system needs is a service or a product as a service, or where, so it's together with the value proposition is the business model around, and here there is a need of a flexibility, and where do you create more value is also very important, how you demonstrate this value.
Thank you a lot. I will take the two last questions. So one is back to you, Maria. How is, in your experience, knowledge, the success of actual PP activity? And are there new alternative proposed or under research?
Yes, so it is true that the public procurement of innovation, it is not easy, especially cross-border, because each country has their national law for procurement. And it's true, the public procurement law sometimes is rigid to procure innovation by the nature of innovation. It is true that it needs more support from the startup side, but also from the healthcare systems. And sometimes it requires more time that is thought. Also, there is different needs for an extra investment. So there is also a need of bringing investors or other source of funding into this procurement. But it's been very successful, not in the case of pediatric, because unfortunately I haven't seen, but in other projects, it's been very interesting and very successful how new ways of procuring innovation has been done in the actual procuring mechanism, and also paying for the value, so different contracts, negotiation, etc. And especially for some key moments, we were ready not to procure maybe together the vaccine for COVID because we had to. So I think there is a long way to go and many things to improve, but it is correct, especially in pediatrics. I think it should be an interesting mechanism to share risk, to share same concerns, also to procure in a way that allow us to get the data we need to continue researching, to continue understanding disease and treatment, etc.
Thank you a lot, Maria. So last question to Wiktor. How effectiveness of an innovation can be rated?
It depends, I guess, from which product would we like to measure, because, for example, we have doctors to create the medical notes, and we get that as a key point, that the learning curve and the numbers of the notes in 1 hour. So it was 2 measurement tools that we get, and in both of them we get really good quality and good feedback from our doctors, and of course the information from our from our professionals is also very important for us. But in other hand, sometimes we collaborate, for example, with MedUp, that we use their Googles in our operation room. And right there, we cannot measure our using of this technology. We try to compare the time between the operation with Googles or without Googles, but we don't have any spectacular disproportion. So for us, it was a really good sign that this Google not prolong the period of the operation. So we also get this as a good mark to get this implementation as well done or check. Director, do you want to add something?
I think it's enough, because the different, we adopted the different technologies in this, not so there are in the last one, there was both the good prepare adaptation, because the both of the firms, they are on the high level and with big the many adolescent applications.
So it depends. We don't have a good answer for that question. It's really unique for startup.
Perfect. Thank you a lot for your insights. I think we can close this training capsule. Sorry for the delay. We have been a bit over time. But I would like to say a big thanks to the speakers for all the insight and the key points that you bring to the session. Thank you also for the attendees to participate today for this first training. Please stay up to date if you want to continue following i4KIDS in LinkedIn, on the web page, or in the innovators community that we have. And we are also inviting you to our next training that will be in January 2024, and we'll talk about startups. So with that, I wish you a really nice day, and thank you again to all.
Thank you all.
Thank you.
Thank you so much. Bye.
Thank you. Bye.
Thank you. Bye bye.